Hi, today we have the Herbst oral device for snoring and apnea. I will be showing you how to advance this device. We are assuming that you know which is the upper and the lower part and which is the left and the right, that you've already worn it for a while and it's time for an advancement. These instructions will be for my patients, but there are many other dentists that are trained in the sleep apnea field that also will be following the same instructions, but please ask them prior to doing so. So we're going to start with using, this is the key that you'll be using. If you are traveling, it is the same diameter as a larger paper clip, but that will be the advancement tool. This is used more to check the hinge for snugness to make sure that it is secured, but this is the one that you'll be using for the adjustments. So you'll be picking up the device, and our patients or our devices usually have an arrow embedded just for ease. Not all devices will have an arrow there. If yours does not, definitely you want to look. There's on this metal component, there is a minus and a plus right there. I know it's difficult to see, but again, a plus corresponds to the top of the arrow, and then the minus will correspond to further away from the tip of the arrow or the base of the arrow. So when you advance the device, typically we will want to insert the device from the hole furthest from the tip of the arrow or closer to the minus hole. You're going to advance it as far as it will go and out. And then usually we'll tell our patients to do this one more time, so 2 turns. Advance it and then out. And then you would want to do the same for the opposite side, but the arrow will be pointing the opposite direction, and so is the minus, and the plus will be going the opposite direction. So in this case, the minus is right there corresponding to the base of the arrow, and there's a plus right here corresponding to the tip of the arrow. So in this case, you'll find the hole closest to the base of the arrow, and then just advance it in the direction of the arrow and out. And one more time. And out. And it's important to do so equally on both sides unless you've been instructed to do something else. One other thing to do to check if you are going in the right direction and that you're even, this area there will be a screw that will be showing, and it should be equally. Now I over exaggerated this as an incorrect advancement by there is a very little space here, and on this side there's a much bigger space where that screw is showing. So this is not equally from the beginning was adjusted. So if you ever forget, you can always rewind back to the beginning and then go back to the count how many turns forward. It should be the same amount doing so on both sides, so then you can normalize and get them equalized again. So again, this should be equal on both sides. When you advance it, usually you'll be advancing it 2 to 4 turns every 3 to 4 nights until symptom relief occurs or any kind of discomfort occurs. If there's discomfort, it should stop advancing it. Talk to your dentist until further directed otherwise. Thank you.